Hello, everyone. Can you hear me clearly?
Yes, clear. Carry on.
Okay, we will start about within 2 to 3 minutes. Our chair time. So after that, we will start our webinar session.
Good morning, sir.
Morning.
Good morning, sir. How are you?
And how are you doing?
Fine, thank you. Good morning, George.
Good morning. Good morning. How are you, sir?
Fine, thank you. And good morning, Madam Horain.
Good morning, sir. How are you?
Dr. Helal, how is your head?
Okay. Good morning, good afternoon, good evening, everyone. Welcome to CIRDAP webinar series of 2023. My name is Hurain Jannat. I'm a communication officer in CIRDAP. So today is World. We are going to have a webinar on World Health Day, which recently has already celebrated on 7th April. So before our webinar, I would like to say something about our organization. It's a intergovernmental regional autonomous organization which promotes integrated rural development in the Asia and the Pacific. And CIRDAP established on 6th July 1979 with the initiative of countries of Asia Pacific region and FAO. And we have three governing bodies: Governing Council, Executive Committee, and Technical Committee. And you can see in our in this map our 15 member countries, and Bangladesh is the host country. And this is our headquarters, the beautiful Chamile House. It was established in 1920 in British period. And after the independence in 1987, our host country Bangladesh handed over to CIRDAP. Now, on behalf of our Director General, Dr. Charsa Virapad, I will welcome our Honorable Director Research, Professor Dr. Mohammad Helaluddin, to provide his welcome remarks.
Welcome everybody, Excellencies, ladies and gentlemen. I welcome you all to today's webinar. This webinar is the topic is chosen based on UN World Health Day. It was a few days earlier. The purpose is like health. I mean, it's very vital, and we know that the entire world has suffered from the shock that we have got from COVID-19 pandemic, and the world is trying to recover from the economic disaster that we faced so far. Now, obviously, health brings everything in terms of like consumption. You cannot consume if you are not healthy. You cannot produce if you're not healthy. All the economic activities will not go ahead without human activities. And that's why when our movement were restricted during COVID, world suffered. But except, if you go beyond this COVID pandemic shock, even before, we know that every year we are suffering from different type of diseases that is affecting our health. And when we are looking about the development, economic development of the world, one issue is like income inequality. And one source of income inequality is the health. Because if you're not healthy, you're not part of the labor force. If you cannot engage yourself actively in production system, then you are not receiving any part of the income, national income or global income. And that's why all the policy making paradigm all over the world, they are looking into health dimension. If people are healthy, then definitely they will remain active, they will remain productive, they will engage in production. And we'll see that everybody is having income and consumption, and that's how we can reduce our inequality. But even without this pandemic, we know that there are different windows for that kind of diseases and affecting our health. So one is waterborne diseases. So I'm sure that our distinguished speaker today, Grinson George, he will focus on that kind of aspect, waterborne diseases. So I welcome Dr. Grinson George to present his slides, and afterward there will be a session, open discussion session. So I'll welcome you all to enjoy the presentation and then later participate in the discussion. Thank you. Dr. Grinson George, please start your slides. Yes.
Thank you, Dr. Hilal. I will try to share my screen. Hope I am audible and my slides are visible.
Yes, sir.
Yes.
Yes.
Okay, thank you. Thank you, CIRDAP, for the opportunity again, and Professor Hilaluddin for the kind words and the insightful introduction to this topic. As you know, in the rural setting, when CIRDAP is organizing a webinar, it has to do something with the rural setting because rural development is the prime motto of CIRDAP. So, as Dr. Hilal was indicating, when health is not there, the productive days are not there. There is a lot of problems related to employment when the health is down. And in a rural setting, particularly water-associated diseases is playing a big role. So in this talk, I primarily would like to focus on how water-associated diseases are posing a major threat, as indicated by Dr. Hilal, to the economic activities of the globe. And emphasis is given to India because now I belong to India, even though I was working for SARC for the last 3 years. Now I am back to India, and I will give some indicators on how India is doing in this regard. And I am trying to merge the water-associated diseases. Being a fishery scientist, my main interest is water and the water-associated diseases, how it is infecting the community. So through the environmental monitoring of water bodies or aquatic environment, whether we are able to do some justice to the information related to water-associated diseases. This is going to be the prime focus, for which different tools are being used. We can use Earth observation systems. We can use numerical modeling systems. We require in situ information, and a team of multidisciplinary people are involved in developing this. So in my team, there are microbiologists, there are medical doctors, there are environmental scientists, and citizen scientists also, who contributed really to different sections of this talk. So let us start the talk and move. Just an introduction, I would like to say, like most of the countries with a rural setting, or most of the continents with a rural setting, particularly Latin America, Africa, and Asia, the water pollution has worsened since 1990s. Over the past 3.5 decades, it has become pretty bad. The water resources are becoming more and more polluted. This has resulted in a lot of different diseases seen globally. 80% of them can be linked to contaminated water. And at least 2 billion people use drinking water which has got a contaminated source. So people are using contaminated water sources. When they are using contaminated water sources, waterborne illness occurs, either when they are doing recreational activity. It need not be a game or fun activity. It can be related to their routine activities like bathing, swimming, and related issues. At the same time, drinking water contamination is prominent because disease-causing microbes or pathogens enter into the body of the people through contact when they do recreational activities and as an inoculum when they drink the water, which is contaminated. At the same time, they acquire such waterborne pathogens through contaminated food or beverages, either because of their interaction with animals or environment which is having the pathogens, or from persons which are infected. Person to person transfer is also happening. Some major microorganisms, the toxins generated by them, along with other contaminants, causes serious disease conditions such as acute diarrheal infections such as cholera, diarrhea, typhoid, amoebiasis, hepatitis, gastroenteritis, giardiasis, campylobacteriosis, scabies, and worm infections. More than 3.4 million people die every year due to water-associated diseases. It's a huge number. Mostly they are from underdeveloped countries, which is from a rural setting. According to the World Health Organization, the disease diarrhea or acute diarrheal diseases itself claims the life of nearly 1.8 million people. 12 million people are infected by typhoid. 780 million people lack access to clean drinking water sources. When we look into the Indian scenario, as I told, I will be speaking a little bit from the Indian background also. India has recorded 69.14 million cases of water-associated diseases, which includes cholera, diarrhea, typhoid, hepatitis, during the period of 2012-2017, when the data is available, and over 10,000 life and 73 million working days. As Dr. Helal was pointing out, the productive working days are lost, and it is estimated that 73 million working days are lost every year in India because of this water-associated diseases. The main planning body, Niti Aayog in India, indicate that nearly 40% of Indian population will only have limited access to safe drinking water when we reach 2030. That is, in 7 years, only 40% of Indian population will have limited access to safe drinking water. 60% already will suffer. So these are some of the statistics. When we link them to the global sustainable goals, we know that around 3.6 billion people, 46% of the world's population, lack safely managed sanitation services. Like there is no infrastructure. I will be discussing these details in the coming slides also. 494 million people practiced open defecation. Even though there are a lot of promotional campaignings happening regarding open defecation, still this is a practice in many of the rural settings in underdeveloped countries, and 494 million people globally practice open defecation still. 2.3 billion people, that is almost 30%, one-third of the world's population lack basic hand washing facility. Even when it is contaminated, they don't have proper hand washing facility like soap and water, which is a wash protocol which has been promoted by the World Health Organization. Even though the campaigns are available, the slogans are available, the minimum infrastructure of soap and water is not available at home. Therefore, globally, also. When people, 1/3 is not having access, almost 50% is not able to process the contaminated water. The lack of water quality data over 3 billion people is still there. We have around 3 billion people without any proper data or information on water quality. 2.3 billion people lived in water-stressed countries. There are countries, all from the rural settings or underdeveloped countries. 107 countries are not on track to have sustainably managed water resources by 2030. Coming to the surveillance part, what is happening in India, I told it's a multidisciplinary approach. Despite the formulation of integrated disease surveillance program, there are a lot of complex challenges faced by India even in predicting or giving an early warning on infectious diseases. This is a centralized, integrated disease surveillance program is a centralized state-based surveillance system, decentralized state-based surveillance system where a range of diseases, including public health, is addressed. Data from private sectors, definitely it is not reaching this decentralized state-based surveillance system. There is a national health monitoring team. Most of the syndromic surveillance, non-specific health indicators, including signs, symptoms, as well as proximuses, are used as an alternate system. For example, when an anti-acute diarrheal disease outbreak is there, generally it is treated as dysentery or vomiting, something like that. And the public health system report it as only a vomiting or dysentery case. it is not seen that the etiological conditions are not properly looked into. So therefore, there is lack of lot of data issues in this. Government reporting only includes cases that are diagnosed at public hospitals, such as public health centers. For example, in case of Bangladesh, when we say like ICDDRB has got a data specific issues, but there will be a lot of people going for private clinics. There will be a lot of associated medical facilities are available. They may go out for over-counter medicines also. Such data cannot be recorded. So because of that, there is lack of proper data recording in case of acute diarrheal diseases. Now, coming to the water-associated diseases and the Sustainable Development Goal of UN. From the Indian perspective, we have, I told you, we have recorded 69.14 million cases. So, when we have a big challenge in the form of a lot of people getting affected because of this, a lot of lives lost because of this, and working days lost because of this, we have a big target to achieve. The basic idea is that people should have universal and equitable access to safe drinking water. It should be available in adequate and equitable way with proper sanitation and hygiene. For that, we have to improve the quality of the water, and this can be done by implementation of integrated water resource management. We have to protect and restore water-related ecosystem. Basically, there will be natural resources of water sources. We have to protect them. There are some issues where international cooperation is envisaged. There are issues of transboundary rivers, water sharing issues, and some countries may be lacking capacity related issues where human resource development is a major concern, which is basically for the developing countries or underdeveloped countries. And sanitation related issues are there where developed countries can be leaders providing training for these countries. Now, some different types of water associated diseases. We have waterborne diseases because of the consumption of contaminated water, like I told about the acute diarrheal diseases like cholera, diarrhea, and typhoid, and other water related diseases, which are mostly the vectors that breed in the water. For example, many of the open aquatic ecosystem, we have aquatic weeds. And these aquatic weeds, along with the stagnant water pools, generate a lot of mosquitoes. Sometimes rat urine is coming into this contaminated water and leptospirosis problem comes. Mosquitoes spread malaria, dengue, and related diseases. So water-related vector-borne diseases are also under the concern of water-associated diseases. We have sanitation and hygiene-related disease also, because since in the community people are not personally following their proper hygiene protocol, we have issues like lice, ringworm, and trachoma. There are a lot of neglected tropical diseases also, which are often seen because of unsafe drinking water, poor sanitation, and insufficient hygienic practices, such as dengue, leishmaniasis, facetiasis, schistosomiasis, lymphatic filariasis. Now, when we look into the different activities, whether it be industrial, agriculture, or community-related activities, there are different causes we can attribute. The first cause is the contamination of drinking water sources. Second cause is because of the poor sanitation and hygiene practices. And third cause is lack of access to safe drinking water. People want to follow these protocols, or people want to have proper drinking water sources, but there are lack of access to them. And finally, even climate change and natural disasters. For example, when a flood is happening, the flood break all the barriers. Sometimes the sanitation-based protocols cannot be followed in flooding conditions. The septic tanks get mixed with the drinking water sources, all results in acute diarrheal diseases. In addition to this, we have the problems related, like I told about the open defecation, improper hand washing, lack of sanitation facilities, even soap and water, poor infrastructure. There is no toiletry facility for many of the rural settings. The poverty itself, they don't have the purchasing capacity. Insufficient investment by the public support systems in water supply systems, changes in water availability and quality, increased vector-borne diseases. I told, like, because of the stagnation of the water bodies, most of the water bodies, aquatic ecosystems are turning into swamps. For example, previously they were lotic or running water habits like streams or rivulets. Because of the constant lack of management, they have become from running to stagnant water bodies, which has become almost like a swamp, and they create a lot of vector-borne diseases, damage to water infrastructure, displacement and crowding, particularly in South Asia or even in the Asia Pacific region. The population density is very high. In the South Asia itself, with 3.5% of geographical area, we have 25% of the population remaining there. All this create a lot of issues related to population and associated health issues. Microbial pollution, it really affects human population in different way, and it has got a big role to play. When we look into the demographic structure of the people, global population, half of them live very close to towns and cities which are close to the coastal areas. Within 100 kilometers of the coastal areas, they are coming. So coastal water quality is very important. That's why, as a scientist from Marine Fisheries Research Institute, I was interested on the coastal communities and how this water-associated diseases are creating a problem to coastal communities. Marine environment really functions as a platform for exchange of antibiotic resistance, virulence genes between allochthonous and autochthonous microbes. So the microbes which are existing in that particular locality and those who are coming from different localities, they become antimicrobial resistant because of different activities, human-related activities. They are remaining in a natural source. It can be a backwater system, it can be a coastal beach system, or a riverine system, or a reservoir system. But the problem is like, because of the anthropogenic interventions, what is happening? The effluents which are coming from untreated waters, the excess antibiotic residue coming through these waters, all create a lot of antimicrobial resistance in these water bodies. Because of this, increasing number of pathogenic bacteria has been reported from marine environment also. What happens in the terrestrial environment, it has got an effect in the coastal environment. So all this has been reflected in the marine environment also. Because of all these issues, gastrointestinal and wound infections are more on increase. For example, we unknowingly go to beach for a recreational activity. Some minor injury happens. And through that injury, if there is a contaminated source of water, the infection starts coming in. Once the infection starts coming in, we go to the public healthcare system. Sometimes it remains untreated if you don't have the purchasing power. But when you go to the public system or the private system, when we go for the further testings, we realize that there is a lot of antimicrobial resistance already happening in the aquatic systems, which has got a prevalence on the health issues of the person who is affected. Globally, 170 million enteric contaminated cells major problem what is happening in the coastal communities. Now, understanding the type of microbial pollution, what is happening in the waters, we really restore to coliforms as an indicator species what is seen in the open water system. The total coliforms which has got the lactose fermenting ability. So, particularly the Escherichia coli, which we are as an indicator organism of fecal contamination. Why we consider them as indicator organism? A good indicator microbial organism is easy to be tested in the lab. It is present in greater numbers than the pathogens they are indicative of, and they are safe to work in the lab. For example, if a particular disease-causing pathogen is very lethal, there can be reservations among the people who are working on it also. So indicator organisms should be easy to work or safer in the lab also. For example, when there is a case of Ebola outbreak, or initially when the COVID outbreak was there was resistance even among health practitioners to deal with it. So indicator organism should be easy to test. It should be present in large numbers than the pathogenic organism, and it should be safer to work with. What are the key indicator organisms? The first, definitely I told, it's the coliforms. And in coliforms, I have to bring your attention to this particular fact that they are very active at the human body temperature. That's why they reside safely in the gastrointestinal tract. But the problem is like this 37 degrees Celsius, what we are speaking about the environmental temperature, the coliforms, when they escape from the gut and reach the aquatic environment, presently, because of increase in temperature due to climate and 37 or near to that, so the bacteria can easily survive there. They form their colony there and reside there. So this is a typical issue what is being faced by tropical countries. The organisms which used to previously reside only in the human intestine, they now have a safe haven in the open aquatic bodies once they reach there. They have sufficient nutrition available there. They have sufficiently relevant temperature in the system because the temperature has increased to the level of the human temperature. When we come to coliforms, the main bacteria are Citrobacter, Enterobacter, Escherichia, and Klebsiella. Others are also there but found only in the environment, not in the human conditions. When we consider this key organisms, the key organism, the Escherichia coli, why it is considered as like it is the most appropriate group of coliform to indicate fecal pollution. When we feel that our water is contaminated, we generally go for testing of E. coli. There are different strains of it present, and very few strains are pathogenic. More than one strain of E. coli may coexist in the intestinal tract. In the same person's body, it can coexist. The different strains can coexist. They may displace one another 3-4 times in a year. Pathogenic strains may cause 1 or 3 types of infection. It can be generally the urinary-based urinary tract infection, neonatal meningitis, and intestinal diseases. When we consider the tropical rural population, all these 3 types of infections are very prevalent. People generally go for testing of these things only in the tropical rural setting, and even in the urban setting also, because in our urban setting also this type of prevalence is pretty available. Now coming to the different indicator organisms, we are interested in the fecal streptococci, which is a gram-positive organism, and there are selective media by which we can easily check it out. There are enterococcus, which are all fecal streptococci that can grow at pH 9.6. It has a wide range of temperature range from 10 to 45 degrees Celsius, and in 6.5 ppt it can grow. Bacterioids, they are obligate anaerobes, most predominant bacteria found in the gastrointestinal tracts of humans and animals. There are other key indicator organisms such as sulfite-reducing Clostridium, perfringens, bacteriophages, coliphages. And when we look into the pros and cons of this indicator organism, the concept I have put here within what is available in the different, there are different positive sides about this indicator organisms. As I told, it should be simple and it should be a cheap mechanism to understand about these pathogens, and they occur the pathogens and they occur in large numbers. Their concentration limits can be fixed with the help of health management. A relation between concentration of indicators and pathogens can be easily made, and source tracking is also possible. Like, for example, E. coli is happening, we link into the different source tracking mechanism from where that particular source is coming from. The cons part, when we look like, it's only media-based assays. It requires 18 to 24 hours for detection. It's a pretty long time when we consider an outbreak or such a situation. Current technologies are prone to false positive cases also. That is a big threat. If we give false positive, that is a big threat. And false negative also is a big threat. So either way, it is happening. So current technologies are not sufficient when we do the media-based testing. And media-based techniques do not support finding viable but non-culturable forms. Occurrence in the environment do not always confirm the presence of pathogens. Some indicators can survive and multiple in the environment. So coming to the knowledge that there are a lot of microbes associated to the aquatic bodies, we have come up with a strategy. Our strategy was named as Revival, and this was done in the case of a small lacustrine system called Vembana Coal Wetland System, which is in the southwest coast of India, based in a state called Kerala. The exact location is the city of Kochi in Kerala. We developed an integrated approach. I told there was a team of scientists from different disciplinary backgrounds, and they came together. We exploited Indian and United Kingdom's expertise. We had a close collaboration with some of the agencies in United Kingdom also. The Indian counterpart was funded by Department of Science and Technology, and the UK counterpart was supported by the NERC in UK. We used multiple platforms and multiple techniques for fieldwork. We sampled at multiple scales. On an average, every month, more or less in 3 weeks, we used to do the in situ sampling, and we engaged stakeholders through the citizen science network. We wanted the people to be aware of the fact. We wanted people to generate data related to water associated issues so that that data can be included in the models of our study so that the liquefaction system can be protected. We incorporated proper numerical simulation techniques also for short-term forecast. This is in nutshell how we organize our programs. In addition to the data what we have collected, we have utilized not only the model data, we have used the Earth observation system data, which is mostly based on the satellite remote sensing perspective. We wanted to see like how the lake community structure is changing using satellite remote sensing, how the different variables associated with the water associated diseases, like it can be temperature, it can be salinity, it can be the floating vegetation, different indices we have developed, and proper algorithms for retrieving such information. And we have linked them to the water quality and the different microbial, phytoplankton, zooplankton, floating vegetation, and different benthic and other organisms with the proper weightage to the bio-optical properties, the optical properties of the water, which is mostly color-based. And basic parameters what we were measuring is the water quality variables and temperature as a climate variable. And we have come up with a multi-pronged epidemiological model, finally giving a solution of giving advisories, proper forecasts to the areas where the communities reside. If a particular water area is getting contaminated and a lot of environmental variables are triggering a particular sort of contamination or outbreak, we want to give them a This is one very recent in last week. One of the major dailies in India, they published one of our findings, which indicated the high levels of fecal contamination in Vembanad Lake. So our idea was like, we have information on the microbial quality of the water bodies and we wanted to link them with environment. So environmental reservoirs of the Vibrio cholerae, the chief pathogen what is causing the acute diarrheal disease or cholera. We have tried to see like how this environmental reservoirs are creating a challenges for ocean or optic data. Generally, when we say remote sensing, we don't believe that remote sensing data can provide some information on the microbes what is present in the water. We think that we cannot see them with naked eye. Even it's very difficult to see, identify them under a microscopic observation. We have to go for specific tests. But when we are seeing that spatial data can spatial data can give some spatial data can give some information on the microbes present. It is a really very wonderful tool. We have a lot of Earth observation data available, satellite remote sensing data available. We have to link with the environmental data. So we adopted to the monitoring of water bodies using bio-optical data, which is mostly based on satellite remote sensing. But for developing this bio-optical based monitoring of aquatic bodies, we should know the optically active constituents what is seen in the water, which is generally guided by the color of the water, and they are suspended particulate matter, pigments, and colored dissolved organic matter. So from a satellite remote sensing, we can acquire information in the water. We use sensors and satellites to derive these optically important constituents. In addition, to the in situ data what we collected and the satellite remote sensing based Earth observation data, we wanted to use the involvement of citizens or social or community based scientists or crowdsourcing based scientific data collection to add to our scientific work. So we resorted to the collection and analysis of data related to this aquatic bodies with the help of public. And this is very prominent in case of different parts of science. And when we have seen that it is successful in those areas, why don't we use them in water associated and related cases? And it was very successful. For transferring the data, we had a mobile application. For doing the quality assessment of the water, we developed a small pocket-held mini spreadsheet disk, and we made a network of citizen scientists. And these citizen scientists started sending the information using this mobile application to the Central Marine Fisheries Research Institute where I work, and this data collected was utilized in our scientific analysis and scientific data accumulation process. The citizen science, they use this small equipment called Seki disk. This Seki disk will give us two information. The first information is on the color of the water. So in this, they started giving us the information on the color of the water. At the same time, they use the Seki disk measurements, which can be interpolated. So these are the different types of colors. When we did the measurements with the help of the citizen scientists, we can see the different color codes, for color codes, and images associated with it. So this is being tried to be made more refined with the help of artificial intelligence tools. One of the research scholars working with me, she is working on the watercolor-based image analysis using artificial intelligence tools to refine the technology what we are using. You can see the type of data generated by the citizen scientist. A lot of data has been generated, and data is very much valuable to any scientific effort. And when we particularly do advisories or forecasts, we require a lot of data support. So when we could see such a lot of data being arriving from the citizen scientists, we did a quality check, and their data was brought into the scientific platform. And we started comparing with the in situ information, the satellite remote sensing information, what is available. And we could see like lot of good relation between the data collected by the citizen scientist and the real scientific data. And the citizen scientist data is always cheaper, and if its quality can be ensured, we are getting rich scientific data to monitor the lacustrine ecosystem. So we have the citizen science tools, which is based on the product, and we get spectral information. This is going to fill the gap between the in situ and the satellite data, which is a proper crowdsourced data, which is representing the entire aquatic water body. So for this, we require smartphones, and the smartphone images which are collected by the citizens, when they measure the color, it is also coming to us. And we are again quality checking the images they are sending along with the information they are generating, and try to analyze them using artificial intelligence and bring in very productive results. So we could see like there is good correlation between the turbidity values which has been generated in situ during our scientific collections and as well as the citizens. There is a good relation we can obtain, and we have developed an algorithm by which we can convert the Seki depth to the turbidity or the quality of the water in which the microorganisms reside. And depending upon the type of the contribution of the different water-based optical ingredients, we could see like there is a lot of contribution of detritus or turbidity causing agent, which is prominent in this particular lake where we monitor. We can see the different components of biooptics as indicated. It can be green in color when there is phytoplankton. It can be brown in color when it is turbid. It can be having yellow substances when there is degradation of the organic matter or dissolved organic carbon is available in plenty. So these results are also clearly indicating that we have variation in the different optical constituents. This is how the chlorophyll is varying. What is the relative contribution of phytoplankton, the colored dissolved organic matter, and detritus, and other optical components when we do this analysis? It was very prominent, and we could classify the entire lake what we monitored into different zones, where the northern zone was having a dominance of detrital matter with a brownish green color to the water, and the central zone having a dominance of phytoplankton, and inshore waters were the colored dissolved organic matter was very much plenty, because when it comes to inshore water, salinity also promotes the degradation of organic matter, and a lot of yellow substances was available in the coastal waters. This is how the spectral reflectance varies when we have different colors of water. The spectra is different, the color of the water is different. So satellite remote sensing can be a tool to identify the color variations and indicate like what is going to be the optical component. This optical component is going to have some relation with the environmental reservoirs of population of microorganisms such as Vibrio, which can be a guiding factor to give the protocol on whether the particular water body is having an indicator which is showing an outbreak of a disease. So when we can integrate all this information, we can, so this is the trend what we have seen, I have explained in case of Vembanad Lake. So we could see like some of these issues are happening seasonally, but some of these issues are aggravated because of the presence of some of the non-point sources from where there is continuous supply of fecal contaminant also. This abundance varies spatially. For example, when monsoon with rains it is happening, there is flooding, and flooding can mix the effluents, it can mix the septic tanks and create a lot of problems. So such problems envisaged also is taken into consideration when we are developing the epidemiological model. In addition, we wanted to conduct some hygienic health surveys, how the people's behavior is also influencing the outbreak of a disease or something related. So we developed an application. The application name is Cleanse, and through this we collected the information from the people, and using the survey, we could see like how best we could associate a drinking water source based on the sanitation levels and how it is linked to the outbreak of a disease. These are some of the results what we could get. Our study clearly indicated that 73% of the households have not done any kind of water quality test. They believe that their water source is very safe. They have not done any testing. And because of that, they don't know whether it is contaminated or not contaminated. Only when there is a problem, we think that it is having the water source is having an issue. So we have a good amount of data generated using this Cleanse application, and 95.8% of the households, even though they have septic tanks, the major problems faced by the coastal communities, like with the climate change, there is increasing sea level, and it is creating a problem to the septic tanks. Increasing sea level creates a mixing of water of the septic tanks with the drinking water source because of the cross contamination. What is happening when the sea level increase happening along with the high tide, there is a flooding happening in the area, and it mixes the water with the drinking water source. So, in order to explore further, our team has come up with few project initiatives. One major initiatives is using the Global Challenges Research Fund of United Kingdom, where we further try to understand the outbreaks of water-related diseases and generate a network of experts. Anyone who is listening this lecture, they can be part of this network. The name of the network is Onward, and there is an active web service dashboard available at Onward web page. And you can be part of this network so that you can support the course of very good quality drinking water based on the network-based discussions what we do. This is the different type of activities we undertake as part of our Onward research. You can be part of this member. We conduct regular training programs also, and we join hands with different organizations. At the same time, in our different project activities, we are trying to identify not only the coastal hotspots, more and more experts start joining this network. They started sharing the data. So we started developing the cholera-based hotspots, what are happening across the India. This same idea can be promoted in other countries also, particularly the underdeveloped countries with a rural setting, where we can generate a lot of data and we can map the cholera hotspots also. And when disease cases are there, we can link them to human behavior, whether the hygienic practices is related to the nature or or other socioeconomic indicators. So we could do such give the proper forecast what associated diseases were we associate with again with the United Kingdom through Plymouth Marine Laboratory, where my three major partners, nursery, from where Dr. Nandini Menon is taking the lead, and the National Institute of Ocean and Review, from where Dr. Anas Abdulaziz is taking the lead, and from Plymouth Marine Laboratory, Dr. Shubha Satyendranath is taking the lead, and from CIMOFAR I am taking the lead. And we join as an interdisciplinary group so as to have proper information on waterborne infectious diseases and global observation in the nearshore waters. So these are some of the initial results which we got in the project. So we clearly now know that the Earth observation and model-based systems can support the forecast, operational forecast advisories which can be generated for such water-associated diseases. And our health surveys or socioeconomic indicators are also very important in predicting or refining the technologies what we are doing through the scientific research. So European Space Agency became interested, and we are now doing a training. The training has started last week. It's satellite-based tool for investigating aquatic ecosystem. This is done under the aegis of Planet Science Foundation. There are a lot of organizations other than the four major organizations I told. There are a lot of other organizations now coming into our platform and funding our course because drinking water is very essential to generate a healthy community and have productive days in the community. So with this, I am stopping the presentation. I know there will be a lot of questions generated. I am seeing that the chat box is having some 17 questions, and let me try to answer the questions if they are within the subject expertise of mine. Thank you for the opportunity. Oh, I think some of these chats are not in English. So I request Korean to coordinate with the people who have given the questions in the chat box so that I can answer the questions. Thank you. Thank you for the opportunity.
Thank you, George. It's a very comprehensive one. And at one part, it was very difficult for me because there are some scientific terms, like but then I forgot, like, I thought I should mention about your background, because once I see your research and I should mention, I forgot to mention about your background. So I will just spend a minute or so to say the background, to explain background of Mr. George. So Dr. George Grinson George, principal scientist at CMFRI, that is Central Marine Fisheries Research Institute, Kochi, India, since 2018. He is on deputation. As I said, it's I guess you are done with deputation, right? So he's on deputation, I thought, as senior program specialist, Fisheries, to SARC Agriculture Center. SARC is South Asian Association for Regional Cooperation of South Asian countries. So SARC Agriculture Center, Dhaka, coordinating the fisheries and aquaculture programs for 8 South Asian nations from February 2020 onwards. George, are you done with your deputation, I guess?
Yes. I'm over with my deputation. Last month, on March 1st, I joined back my parent institute, Central Marine Fisheries Research Institute. Now I am working.
CMFRI, okay. And he has been active in teaching, research, policy, administration, academics, and industry related to fisheries and aquaculture for over 22 years. Specialized in fisheries resource management, he completed postdoctoral research at Plymouth Marine Laboratory, United Kingdom. He served as the honorary coordinator, CPR, Environmental Foundation, and Juliet Messi as an honorary fellow of the World Aquaculture Society. Education, as a scientist. I think someone mic is can you mute the mic of someone's talking? Okay, so it's done. And then his current research focus is on citizen science initiatives to address water quality using satellite remote sensing and marine bio-optics. He is the recipient of Dr. Rajendra Prasad Puruskar by ICAR, Dr. Hiralal Chaudhary, and Dr. Kulkarni Award by CIFE. So it's a very rich background of George. So I will go back to the participants. So it's very comprehensive and it's very relevant for all of the countries. And especially I was kind of like thinking like what happens in case of Bangladesh, in case of part of the India, even in Pakistan, and mostly it's like for like coastal areas when there is like land, first land inundated during like a rainy season. Then there are implications also for waterborne and water-related diseases. So I don't know what policies will be there. So I open the floor for discussion, and you can just ask your question, leave your observations, and also you can leave your questions in the chat box. So please, start your question. And you want to start?
I will just give a small supplement to the query you raised. Bangladesh is doing pretty well compared to the other South Asian countries because of the presence of ICDDRB. So they have a lot of monitoring activities, but unfortunately, Bangladesh succumbs to a lot of extreme weather events such as floods, as you indicated, and that time all the surveillance systems get derailed. But there is an existing mechanism to support such activities in the form of ICDDRB, which is based in Dhaka, and they are pretty good monitoring, but this is still prevalent in Bangladesh.
And also, it's very important, like for what happened recently in Pakistan. There is a sudden flood, and then in case of sewage system and all those things, it is expected to be disastrous. Yeah, so I may pick our distinguished IRD expert if he's still connected. Dr. Ishar.
Yeah, thank you, Dr. Khilal. I'm online in the indeed, I will appreciate the presentation of Mr. George, because he very elaborately dilated upon the waterborne diseases, especially in the context of aquatic sources. So he rightly pointed out that most of the diseases, like 3.4 million people die due to contaminated water per year. Then there are sanitation issues, and most of the people are not having access to drinking water, safe drinking water, nor they're having any sort of the wash facilities. So he's right, and I would appreciate that the Indian government and the UK, wherein they have started their research on the Wimband Lake. That study is quite interesting to me, and I think, as you mentioned, that Pakistan, Bangladesh, we are also facing floods very frequently. And in Pakistan, I would mention that especially dengue is one of the seasonal disease which mostly spread due to contaminated water, and most of the people get infected due to the mosquito vectors. So it is very important, and beside that, the term aqua ape, that is quite interesting, and I think if they have introduced that ape in the locality of Wemben Lake, that is quite appreciated. I would request the CIRDAP forum that at least in some of the vulnerable countries, such like projects gently could be initiated. And as he mentioned, that onward web page is very important, and if anybody is interested, so I think that web page onward, that will be of good use to us. But one question of mine is to George, is that he mentioned that the sources of contamination are basically the hospital waste, then the aquaculture waste, and then the epidemic of fluxes. But he didn't mention anything about the industrial waste, because in some of the countries, most of the industrial sewerage water get mixed with the freshwater streams, and ultimately it leads to damages the aquatic bodies. So one point I'm wondering that what is the policy for the industrial waste management? Then the other point is that, for example, if we are talking of the India or Bangladesh or any other country, that the urban areas are not having the facilities of the recycling of water or the recycling plants. So is there any policy or regulatory framework that the local government or the provincial government, they are taking care of these issues just to ensure the availability of hygienic water to its citizens? So as you know that in most of the industrial units, lagoons and the recycling plants are established, and by law they are mandated to recycle the industrial waste. So these are some of the points which need to be considered, or either he might have focused only to the aquatic part of the contamination. So I think he did a wonderful presentation, and I really appreciate, and we would love that we would be part of the onward web page. And also I would further interact with him on the introduction of the term aqua app. Thank you.
Thank you for your suggestion also. Definitely, in my presentation, I have included the industrial non-point sources also, but I couldn't clearly focus on it. That may be one reason why it went unnoticed. Definitely, it is also a source of contamination, and there are stringent measures by the regulatory bodies to ensure that the industrial effluents are treated before anything is coming out into the natural environment. That regulatory measure is existing. Before starting the industry, they have to take the permissions, and for the permissions, they have to have the proper mechanism by which how they are going to treat this effluent water coming out of the industrial waste, so that the water bodies don't get contaminated. So it is not only the microbes that creates contamination. Sometimes the industrial waste may generate a lot of nutrients, and those nutrients can favorably produce more microorganisms which can create acute diarrheal diseases. So definitely that's a very important point, and most of the countries are taking care of it. But industrial giants definitely they don't want to spend more monies on preserving the natural ecosystems, and because of that, sometimes there are mishaps happening, and sometimes there are least care given for the natural environment, which creates a lot of disaster for the natural aquatic ecosystem. But it's two sides of the same coin. We have to have development at one side, and we have to have conservation at one side. So we have to ensure that the industry is growing with proper mechanisms to monitor the water what is coming out of, or the discharge coming out of the industry is not hampering the environment to a scale in which a disaster is happening. Definitely, that's a point worth taking. Thank you for mentioning that point and focusing more on it. And it definitely, from my side, whatever is required for the promotion of the mobile application or the promotion of the water associated diseases networks, I am always open for it. Some of my team members are also present here for the presentation. I saw Dr. Nandini Menon. She is handling the onward network activities. If she can come in further on it, it will be a welcome gesture. Nandini ma'am, you want to say something on onward network?
Thank you, Grinson. Onward is an open network for those who are working on water-related diseases, not only working on water-related diseases, but also those who are interested in learning, and those who have any type of knowledge about the water-related diseases. And the aim is to learn from each other about how to tackle the water-related diseases and attain the Sustainable Development Goal 6, that is to get access to healthy drinking water by 2030. It's our attempt, and we conduct regular webinars as well as in-person training programs as part of capacity building. And now we have a network of more than 300 members from around 40 countries.
Right.
I want to hear from others.
So, Krishna, would you like to highlight something on this? Is there any program of BOBP which is related to this?
I have some connectivity issues. Like even during your talk, I had some trouble. So maybe I'll catch up.
Yeah. Thank you, Mr. Krishnan. Yeah. So I have one question. Like, it is about aquaculture practices. Like, I have a pond. I cultivate fish, and for the 5, 6, 7 years, I'm losing. I cannot gain. But people are telling me to practice. To have a different practice, like the wastage of like poultry. Okay, if I use them as feed for fish, then definitely feed cost is almost zero, and then I can make a lot of profit. So I know that quality comes at cost. So in Bangladesh, if I want to have a quality fish, obviously I have to use quality feed, and quality feed means like per kg of fish, production cost will go up and price will go up. So we are not willing to pay high, but at the same time, we are trying to consume like better fish, and it's not happening. So so this is one aspect, like when we are looking at like diseases, so the practices are also affecting our like health. So I know that microbial contamination from that also another significant source. So do you have any idea like the kind of like aquaculture practices, how it can affect our health?
The same, the idea is very much being discussed. Good aquaculture practices are very much relevant to the production augmentation process, what is happening in aquafarming. So when we do good aquaculture practices, probably the operational costs are going to be slightly on the higher side, but it gives us quality fish protein. Fish protein is of very much good quality. Previously, we were telling that fish is a quality cheap protein because the price of the fish was less. But nowadays, we know that when it is a cheap fish, it is going to have some issues. I know the typical condition in Bangladesh when tilapia is not favored as a edible fish by most of the upper strata of the society, even though it is available in plenty in different shops and markets. The upper strata of the society don't want to consume tilapia for the obvious reasons which you said. It is available at a very, very cheap price. And people wanted to promote it as an aquatic broiler fish, like just like broiler chicken. Tilapia can be a replacement as quality fish protein. Even the Bangladesh Fisheries Research Institute came up with a program of having super tilapia, which is a developed germplasm of tilapia which can produce. The production process is standardized. The farmers want to bring down the operational cost by any means, and because of that, the price of the tilapia in the market has come down, but definitely at a cost on the quality of the fish. When I was at SARC Agriculture Center, we have come up with a program on promotion of quality value chain, and it is documented. Dr. Vidapat also joined the program that time. So our interest is to have proper quality checks in the value chain so that the quality fish is delivered to the consumer at the best price possible. So there should be checks in this regard, but farmers always resort to cheap ways of reducing operational cost, which results in the quality. That is noticed, and there are different discussions going on how to curtail such practices and improve the quality of the fish meat per se. Even we are worried on the nature of the feed, what is given to the fish, not only the chicken. Even if chicken is given, whether it is halal chicken, even if the fish meal is given, whether it is halal fish meal is provided. So all those discussions are happening because some Muslim countries may like to promote those fish which are farmed, which is having a feed ingredients which are from the halal source. That can be done with the help of frontier technologies which are available now. So such discussions are happening. Even my organization is planning to have a structured program on coming 20th on genetically modified organisms which are used in different feed ingredients. So even we are worried on those aspects. If genetically modified organisms are coming in the feed ingredients, how it's going to affect the aquaculture. So such discussions are happening at a very larger scale in different parts of South Asia, which will definitely improve the quality of the fish which the farmers are producing. That point is worth taking. Thank you, sir. Thank you for mentioning that point.
Anyone else? We have time for more questions. Sabawat from Thailand. Sabawat, are you connected? Yeah. Any observation from the perspective of Thailand?
Happy New Year, Thai. Happy Thai New Year.
Oh, happy.
Happy New Year.
Dr. Grinson, George, do you have any idea for the dashboard, which maybe ordinary people can watch or can monitor what's going on in the seashore or the sea about the water quality, for the maybe some variation of the water quality, something like this? Do you have any idea on this?
I didn't get it. Can you explain it again?
So
What
I just I think your presentation is good for the in the technical point of view, but for the ordinary people to monitor what's going on in the sea or maybe the water quality in the sea, because you mentioned about satellite image to look at or to investigate water quality parameter in the sea, right? So you have any dashboard? It's a kind of dashboard for the ordinary people to monitor, to look at, and or maybe you have some kind of the speculation or forecast in the future, maybe what's going on, because you have data a lot in your server, okay? But maybe you have some kind of forecast or expectation what's going on in the future, because you have many parameters. Now maybe you can forecast in next 5 months or next year what's going on, something like this.
Okay, sir, can I explain? I got the point. In the case of global water quality monitoring system, we have global ocean observation system. As part of the global ocean observation system in the northern Indian Ocean region, we are doing Indian Ocean global observation systems, where we have sensors on the buoys, the Argo buoys and related instruments which are monitoring this. We have 2 dedicated institutes monitoring and doing surveillance in this part of the region, in northern Indian Ocean region. The institute which is measuring is National Center for Coastal Research, which is based at Chennai. And the institute what is operationalizing this data, like generating the water quality related advisories, is Indian National Center for Ocean Information Services, which is based at Hyderabad. And Hyderabad is operating the IGOS, Indian Global Ocean Observation System. IGOS is operated at the INCOIS. And we have different institutes, research institutes who are keen on developing such technologies, which is CSIR, National Institute of Oceanography, which is based at Goa, National Institute of Ocean Technology, which is based at Chennai. In the case of Bangladesh, I know that their Institute of Oceanography is coming up pretty well. And there are a lot of discussions happening between India and Bangladesh also. The university from where I got my doctoral degree, the Goa University, where I had an affiliation to National Institute of Oceanography, recently signed an MOU with the Oceanographic Institute so that there can be bilateral exchange of technology. So such activities are happening in this part of South Asia. I know that Thailand is doing pretty well. You also have renowned institutions all across the Southeast Asian network, and you are also contributing to it, and definitely other parts of the world. Except for a data shortage from the African region, we have pretty good information available globally. And with the flood of information in the form of satellite remote sensing, with new Landsats coming in, new ocean satellites coming in, we have a lot of information coming in. There should be a judicial quality check the data which should be put in use for such monitoring and surveillance program, which can be useful not only for the water quality surveillance, but also for the water associated disease surveillance also. We are also looking into such aspects. Thank you for the suggestion.
Well, that's a good intervention from Sukwat. And someone else, I was expecting insight from Iran. I see a couple of participants from Iran. If not, then I have a question, but I'm waiting for a question from the participants. They might have some in the chat box, sure. Let me see if there is a question in the chat box so that you can look into that. Huren, you tell me if there is a question in the chat box. I have a question like in Bangladesh, we faced a dilemma, like we have to, for food security, we have to increase our rice production. So there are measures for increasing rice production, but the chemicals and other, interventions, it was not good for fish production. And at one point we found like fishes are dying in sweetwater bodies. And that there was at one point we see like almost all the fishes died like in the inland water, something like that. So there should be a balance. So I know that in case of aquaculture practice, someone can, be cheap, and then they can do certain bad practices. But when we're looking at sectoral, like for agricultural crop production, it is affecting our aquaculture. So how to, get a balance there? If we have focus on water-related diseases.
I understand the question. Like when at a point of time when we were marching from the situations where we faced famines to ensure the food security, our primary interest was to augment the cereal production. So for that we have developed packaged practices which involve the using of organic as well as inorganic pesticides, fertilizers, and related things. But over a period of time, we have realized that we could augment the production, but that not in a sustainable fashion, as you indicated. It created a lot of other issues, like even it started deteriorating the health of the quality of the soil, water, and related environment resources. So now, as we progress, once we have reached the limit of required food security and we are producing surplus now in South Asian region, now our focus is to produce them sustainably rather than just increasing the production. We want to do some practices by which we can produce cereals sustainably, at the same time generate protein sources such as fruits, vegetables, pulses, fish, and related protein also, so that the food what we are eating is having nutritional security and it is sustainable also. So such augmented research is happening. For example, a simple example I will tell. When we started using fertilizers, urea was one major fertilizer what we have used. But when India started applying name-coated urea in the agricultural package of practices, the usage of fertilizer has come down drastically. So that is one simple mechanism. Just by coating urea, now in the urea fertilizer market, you will find only neem-coated urea in Indian fertilizer market. So this is one major intervention the research could make in making the efforts sustainable. We can reduce the input of the fertilizer, but at the same time, we will not decrease the production yield. Such efforts are happening in the research side also. Still, it's not foolproof. We have some old package practices still prevalent in many parts of Indo-Pacific region, which has to be slowly replaced. For example, Bangladesh doesn't have so much capacity to have neem-coated urea for the entire farmers' field. So I was part of some of the discussions what happened in the South Asian Forum. The same way, different Indo-Pacific countries will have their own problems to be resolved. Somehow, research is happening at a bigger pace in this direction. So I'm sure, like in the near future, we will be able to provide food as well as nutritional security through sustainable fashion, so that our environment remain intact, not intact, but more or less intact. But at the same time, we are able to produce. Now we are giving less regard to the environment because our prime aim is to achieve food security. So we have done that. Now let us march to the next goal. That is the idea what is being prevalently discussed in scientific fora, and I think this will take a good shape in the coming 10 years.
So I have a point, Dr. Hilal, if I'm allowed. Am I audible?
Yeah, yes, yeah.
So as you mentioned that basically the irrigation water, which is having the fertilizer applied to rice fields or other crops, and then it is drained out to the water streams, and ultimately it's having a bad impact, like the mortality of the fish in the fields, like in Myanmar, mostly the fish is raised with the rice crop. And if it is having the fertilizer or pesticide, it will be having a bad impact. And ultimately there will be a mortality. So I think in most of the developing countries, the irrigation water is supposed to be drained out separately. It is not going to be mixed with the freshwater streams. So drainage is very important. And for that matter, I think we should focus that the irrigation water, once applied, having any residues of chemicals, should be drained out separately.
Oh, actually, it's not only irrigation water. It's like when there is a flood. So entire Bangladesh is like flooded. So wherever you use chemicals, so they will go to like the water bodies. So it's not
Yeah, so Yeah, you are right. As George mentioned, that basically we are supposed to switch over to biofertilizers, and we are supposed to reduce the quantity of the synthetic fertilizers, having less impact on the environment. Thank you.
Yeah. Anyone else with any other question? If not, then I'll get back to Ms. Huren Jannat. Okay. And thanks a lot, Grinson George, and it was very comprehensive indeed. And also, like for policymakers, it's very important. And waterborne and water-related diseases is still a vital source, and it's a huge concern for governments. And one of the global concern is like cost on like health expenditure is a huge concern now. So in order to like reduce allocation for health, we have to focus on diseases. So it's kind of like once we are like ill, then we have to spend. So in that case, like the optimal way is to curb like diseases. So waterborne diseases is still very important, and countries like Bangladesh, India, and also like countries having like coastal inundation, it's very important. Also go through them. I'm thinking to publish like books based on the webinars if authors agree. So thanks a lot, and then I'm going back to Huren Jannat. Huren.
It's always a pleasure. I will join hands with you. Whatever required support is needed, I will join hands with you. Thanks for the kind words. Thank you, Dr. Hilal.
Thank you, sir, for your wonderful presentation. And thank you all for joining us. Thank you. Now it's the end of our webinar. Thank you so much. Looking forward to next webinar. I hope you all will be joining there. Thank you.
Thank you. Regards to Dr. Vidapit also.
Oh, thank you, sir.
See you
Okay.
then.
Okay. Thank you.
Thank you.